curcumin is fine if it is found in the gastrointestinal tissue. There's a local effect, or if it's in cream form over the skin. But it's much more difficult to see effects deriving from systemic absorption of the product, were I to think you decide to do that. This chart summarizes the most interesting chemical trials. The dose levels are in the order of sometimes grams of product. So the bioavailability of curcumin is a problem. We have taken two approaches. First, we standardized the mixture containing curcumin and administered it together with other products present in the root. And then we prepared a compound, a food compound with phospholipids, producing an increase in the bioavailability. The paper was published in 2007 with the Gesche group, and again, this is an example of what you can do when you also optimize the absorbed portion of these substances. These are the curves for the extract complex in the animal. The same data was viewed in humans. This graph shows two curves, two plasma curves, and you can see the difference in the administration. 4 grams of non-complex curcuminoids versus 450 milligrams of the complexed curcuminoid, containing much less curcuma. So today it is possible to optimize substances, first with a standardized extract, and then possibly reviewed for the bioavailability aspect. And I'll quickly get to my conclusions, because I think I'm up. This is another plant that we've worked on. It's a non-edible product, but it can be used it is used very widely in food supplementation. The plant produces silimarine, which is used widely in the West, in the West, sorry. You can see the flavoligands, like lignans, that are used, and these products are used experimentally in oncology, and it looks very interesting. Here we standardized the mixture that you saw before, and then again complexed the product. A number of studies have been embarked on in oncology using this product that have identified a potential use for the product in at least 2 areas, one being in chemioprevention, and the other, equally interesting, and I'll show you quickly this last paper that came out in 2010 from New York, where the product was employed in patients with leukemia, and the toxic effects associated with use of chemotherapy on the liver were studied. And over the past 40 years, much research has gone into using these products for protecting hepatocytes. And last, green tea, a very well-known plant. I'm sure you're all familiar with it. And now there is a huge amount of literature on green tea, not only looking at its possible use in oncology, but in other therapeutic areas as well. The leaf, the tea leaf, can be processed in different ways. Green tea is the first line that you can see, and essentially it's from the non-fermented leaf. The non-fermented leaf includes these derivatives of catechin, and I'm sure you're also familiar with them. Epigallocatechin is very familiar to you, I'm sure. It has very interesting mechanisms of action in oncology. And again, green tea is an example that we often use because the degree of complexity of the product is such that oftentimes studies on complex mixtures do not correspond to one another because the product is so different, both in terms of quality and quantity. So we decided to obtain a highly standardized extract as for the bilberry. This is the fingerprint for the standardized product. It's been used in preclinical trials so far, and we've already made complexes that are bioavailable, and the derivatives of the substance can be absorbed in the intestinal system. So these are my conclusions. I'll be very quick. I hope I've given you a very quick overview of the degree of complexity underlying the use of these products. I hope I've given you some idea of the fact that today's technology enables us to obtain complex mixtures that can be used in controlled trials. Complex mixtures, incidentally, oftentimes have biological effects that are more significant than purified products. So that's something that recently converted the opinion of the FDA, the US FDA, which has now put out guidelines in 2008, which henceforth
cioè prodotti multicomponenti con un grado di standardizzazione importante che possono essere visti come farmaci di sviluppo paragonabili a una molecola di sintesi. Ecco, l'ultima osservazione è appunto che con questi prodotti oggi è possibile avviare studi seri e studi che possono avere dei metri di confronto come si fa normalmente con le molecole purificate. Ringrazio per l'attenzione.